Hi, I am Dr. Manrina Rhode. I am an aesthetic dental surgeon and I am the dental aesthetic expert for dentistry.co.uk. Today I'm going to talk to you about training to get into aesthetic dentistry. So we are really not taught aesthetic dentistry at university. We're not taught smile design. We're not taught basic gingival architecture. We're not taught about embrasures or gingival zeniths or any of these fun things that we learn when we learn about smile design. And I think that's a shame. I think it's an important part of what we do. I think we're very much brought out to do single tooth dentistry, not even quadrant, or to look at the mouth as a whole, never mind how the mouth sits in the whole face. So it's very important when you graduate, if it's something that interests you, if you're going to be a specialist, an endodontist, a periodontist, I would like to say it's not as important, but actually even for you within those fields, definitely orthodontistry and probably perio too, because you'll do gum lift surgeries. It's important to start understanding smile design. So potentially for all of us, endodontists as well, so that you can support your dentist with a dark tooth, if they need maybe space to be allowed so they can do some internal bleaching, if they potentially need to put a post in the tooth and how that's going to look and what margins are going to be visible. So yeah, so smile design is really important, I think, for all of us, and something that they should add onto our syllabus at university. But it's not that. So let's talk about what you do instead. Once you graduate, there are a whole host of courses that you can go on that will teach you about aesthetic dentistry, cosmetic dentistry, how to be a cosmetic dentist. I think the word cosmetic dentist is still used quite widely. I don't like to use it. I think it sounds like makeup, and what we do is so far from makeup that I think I call myself an aesthetic dental surgeon, and I think that's more fitting. The main treatment that I do in my profession is porcelain veneers. I've done over 13,000 porcelain veneers. I teach a course on porcelain veneers, and so I believe that the smile makeovers that we do with porcelain veneers are the most complex thing that we do within dentistry. There's so many things that can go wrong at every stage. There's so many little things that have gone wrong for me over the last 20 years, and every time that's happened, then I've modified the way that I work, my workflow, to make sure that doesn't happen again. And there's a lot to be said for that. So that doesn't mean that it's not a treatment that we should do. It's just a treatment that you really shouldn't try to do without the correct training. So yeah, let's talk a little bit about that training pathway. So there are courses out there, like year-long courses, where you go and attend a day a week for a year, and every day they'll talk to you about a different aspect of cosmetic dentistry. So they'll talk, there'll be a day on whitening, there'll be a day on bonding, there'll be a day on smile design and smile makeovers. There'll be a day on simple orthodontics, and that way you really get a nice outline of all the different procedures that are available to your patients. I don't think you necessarily come away with the ability to carry out these procedures. I think you learn what they are, and then if it's something that you want to bring into practice, it's something that you would then go and learn in more detail in a course specifically for that item. The more we learn, the less stressful our lives are. People who are trying to do treatments that they're not trained in, I'm sure they're just living a really unnecessarily stressful life, getting lines prematurely. So my best secret to anti-aging is to stay within your comfort zone, and that doesn't mean that you shouldn't push out of your comfort zone. It just means when you are ready to, then get the training that you need and make sure you're supported, so that you can carry out treatments predictably. This leads me on to a story that I'm going to share with you. There's this American dental forum Facebook group where people post, and one of my friends in America screen grabbed this post for me, and it said, hey guys, I decided to do these 4 veneers for my patient, but I didn't really know how to do veneers, so I watched a video on YouTube and I prepped these veneers. And then after I prepped my veneers, I put some temporaries on with Temp Bond, but with Temp Bond. But the veneers, the temporary veneers kept falling off, and then, you know, the patient could see where I'd cut their teeth underneath, and they were really upset about it, and it was really uncomfortable, and I had to keep sticking them on, and it was so stressful. Anyway, finally we got to the appointment where it came to fitting her veneers. And as I came to fit them, I couldn't get them to all stay next to each other and fit them at the same time. And I was scared that if I fit them at the same time, that they would get stuck together. So instead, I fit them one by one. But as I fit one, then because that one had set, then the next one didn't fit, and they all fit wonky in her mouth. And it's been a really stressful experience, and I just wanted to share it with you guys. And, you know, what would you guys do? Can you please help? So I got a screen grab of that post, and it gave me palpitations. Why was she trying to learn such a difficult procedure on YouTube? Don't learn your dentistry from YouTube. If you want to learn how to do something, go on a course. There are loads of respectable dentists out there that you can go and learn from. So go and learn how to do something properly. And if you haven't learned how to do it, but it's something that you want to provide for your patients, then refer out to someone that does know how to do it until you do know how to do it. Stay within your comfort zone. That doesn't mean you're losing clients by doing that. Actually, you'll be building your client database, because you will build a referral network to the people who know how to do things really well. So in my clinic, at DRML Clinic, I always say to my patients, if I believe there is someone in the world that can do this job better than me, then I will send you to that person to do it. So I'm only doing the treatments that I know that I'm really good at. Okay, so I've been a dentist for 20 years, and so that's all good and well for me to be like, oh yeah, I'm really good at these certain treatments. And I also understand that there are young dentists out there who want to expand what they know, and absolutely you should expand what you know. But the way to do it is to go on a course, and through that course, make sure there's some form of mentoring, so that when you start providing these treatments and things do start going wrong, which inevitably they will at the beginning, there's someone who you can message and you can turn to, who could be like, yeah, when that happens, then do this, and that will really help you. So I hope that was a good kind of synopsis about training for aesthetic dentistry. It was not doom and gloom. The moral of the story is just go out there, go on courses and learn about the treatments you want to do, and then you can do them in a really predictable way, which will give you a good life.